campaigns that were paused as a result of the onset of COVID and the opportunity that countries needed to figure out how campaigns could be done in a safe and effective manner. So the guidance is being released, and it really calls on countries and provides recommendations and advice on the various attributes to consider. Certainly the availability of the necessary protective equipment for healthcare workers to protect healthcare workers, but also to assure families and communities that they will also be safe in seeking those services. One of the big issues we've found is that people are reluctant to come for immunization services out of concern for themselves and out of concern, of course, for the healthcare workers. So part of the planning that countries are now able to do is have greater clarity on what protective equipment is needed for immunization services, which is different than what is needed when actually treating patients who have COVID. In addition, we've heard and seen that there are innovations around how campaigns can be conducted. With physical distancing, campaigns can be conducted, and they can be conducted in a safe way. And so countries are able to assess the degree to which there is risk for the vaccine-preventable diseases and weigh that against their readiness and their ability to secure the healthcare workers to conduct the campaigns and to assure that there are the protective equipment for those healthcare workers.
Thank you, Dr. Brien. Maybe Henrietta or Seth would like to add something?
So may I just add that to Kate's very good points, there are some countries that have large populations of unimmunized children. So Nigeria, Ethiopia, Democratic Republic of Congo, Chad, Philippines, Ukraine are some of them. So those would be countries that would want to really think about the planning for how they can restart their campaigns.
And if I can just add to both of the excellent comments, there also is an important role here in technology and innovation. And so, for example, in Pakistan, one of the things we've been working as an alliance is to have better tracking, for example, in urban slums, to be able to figure out how those campaigns are going on, when the hours are, and to use that as a way to track people who are vaccinated. So if you have tools like that available, then you can stagger the times of immunizations. You can also bring people back in at different time points and avoid some of the gathering. So I think this is some of the innovation that's going on. And what's exciting about it, and I think this is potentially the silver lining over the long term, is that we might see better organized situations, better campaigns going on that are not only directed at any one pathogen, but coming together with multiple pathogens and done in a way that is more convenient for particularly women, who obviously are major caregivers in terms of being able to do that at a time that's appropriate. And so these are things that can be done over time, and hopefully as we get back to normalcy, we'll be able to not just go back to where we were, but perhaps go back even better as a set of tools to do this. Over.
Many thanks for these answers. We will try to go back to Jamil, who I understand is now available to move with his question. Jamil?
Thank you. Can you hear me?
Yes.
Yes, fantastic. Thank you, Tarek. Dr. Tedros, a question on Brazil. With over 1,000 deaths in the last 2 days, what do you make of the situation in Brazil, and whether you're negotiating any kind of assistance directly from WHO to Brazil? Thank you.
Which country did I miss? Oh, Brazil. Sorry, I missed the country. Sorry, I heard the question. So many countries. Yeah, the situation in